I'm Dave Holland, Reform Party spokesman for Mid Bedfordshire. However you're viewing this video, please like, share, retweet, subscribe and follow. Let's stay connected. Only 30 years ago we had 56 million population, 340,000 NHS beds and 468,000 nurses. Today we have a population of 70 million, 130,000 beds and 325,000 nurses. So 20% more people, only 30% of the beds and 70% of the nursing staff to look after them. But NHS running costs have gone up exponentially. Additionally, we've closed many convalescence homes in favour of care in the community. I'm no expert, but it's no surprise that the NHS doesn't work, is it? A larger population needs more customer-facing resources, not less. Add in the shortcomings of our privatised part-time GPs pushing more people into A&E, and hospitals struggle because of the system inept managers have created. The last Labour government tied a financial millstone around the neck of the NHS. PFI has added billions to the NHS's costs. I don't understand why we're paid £12 billion for a £2 billion hospital, or why we pay £125 for a £5 light bulb. The people who sign those contracts should be in prison, not the House of Lords. We are paying £12 billion plus for a £2 billion hospital. Thanks to the economic genius that is Gordon Brown, the Chancellor that socialists considered to be prudent. I have great sympathy for the hard-working doctors and nurses working in the UK. It is not their fault that the NHS is broken. Here's what we need to do. We need to get more GPs working longer, more flexible hours to take pressure off A&E. We need to add bed capacity into hospitals to reduce the ambulance backup bottleneck. A&E will then have the capacity to accept ambulance patients as they arrive. We need to open up convalescence homes to free up hospital bed spaces. Wards will then have the capacity to accept admissions from A&E as they need them. These three steps will resolve many of the failures in the NHS. I realise there are many other issues and obstacles standing in the way of making our NHS function to a minimum level of acceptable service, but by addressing the biggest ticket items, we will be able to maximise NHS capacity. When no one has to wait for an ambulance, when no one has to wait for a hospital bed, when no one has to wait for a GP appointment or an operation, then and only then will the NHS be fit for service and be the envy of the world. Combined with Dr. David Bull's strategy to cut NHS waiting lists to zero, ReformUK will make the NHS work for you.